multiple fires driven by severe drought conditions and high winds.
Catastrophic flash flooding there earlier this week.
Deforestation has now reached the highest level in 15 years.
Unsafe levels of pollution.
Contaminants in our drinking water.
Chemicals, metals, and radioactive substances.
The warmest summer ever recorded.
55 degrees below zero.
Microplastics, one of the biggest issues facing the world's oceans.
We are seeing, particularly in the last 30 years, a very abrupt increase in the amount of patients being diagnosed with autoimmune disease. Also, patients who have found in their blood work signs of autoimmunity, so autoantibodies that the immune system was not supposed to be producing. The other thing that came in parallel in the last 30 years is that our environment has changed significantly, right? Different from our genes that have been pretty stable for millions of years, our environment has really changed. So I am inclined to believe, as a rheumatologist, someone who sees patients with autoimmune diseases, that there must be something in the environment that is causing this surge in autoimmunity in our population.
We're seeing increased changes in our climate, and we're concerned because these changes are going to result in more air pollution, more ultraviolet radiation exposure, decreases in food production, decreases in water availability, and a wide variety of stressful effects on populations around the world. And we know that all of those are also related to increasing not just the frequency of autoimmune diseases, but also the flares of disease for people that already have existing autoimmune diseases. We need to prepare for all of these things. We need to educate ourselves about these risks. I think we have to consider developing emergency plans. So healthcare systems need to consider how they're going to back up their systems. They have to think about supply chain issues. How are they going to be sure that they have adequate medications? Patients themselves need to think about this and try to back up whatever medical needs they're going to be having to deal with. Think about using the appropriate sunscreens and the ways of controlling sun exposures when we do have these large amounts of heat that are occurring.
So if there is any chance that you are in a place that has been affected most recently by wildfires and very large levels of air pollution in general, it seems reasonable in those days to try to stay indoors. Air purifiers can be really, really helpful in diminishing the amount of particles we are inhaling. And if going out, using a mask may be really helpful, trying to minimizing the amount of exposure you have to agrotoxins. They're coming from food, to buy foods from organic resources, local resources, trying to replace the plastic containers you have at home, for example, water bottles, to things that are coming in glass or aluminum. So you're less exposed on a daily basis to microplastics. Avoiding ultra-processed foods as much as possible. It is probably a good thing to adopt if you want to decrease your risk to develop various diseases, from diabetes, cancer, to even some autoimmune diseases.
We should think about all the things that we're doing on a daily basis and thinking of the impacts that they're having, and think about alternatives. Some of these might be considered less convenient or less efficient, but in fact, if we think about the long-term effects, they actually may be much better for us.